Hello, everyone. My name is Brandy Binkley. I'm the Public Health Administrator at the Macon County Health Department. We just wanted to let you know that moving forward, we will be posting short videos occasionally to make sure that you know what's going on in your community in regard to COVID-19. We have also been sending out daily press releases regarding COVID-19 on behalf of the Macon County Crisis Communications Team. If you have not gotten a chance to see those and you don't know where to find them, you can find them posted on our website, which is maconcountyhealth.org. You can also find them on our Facebook page, which is Macon County Health Department, Decatur, Illinois. You can rely on us to provide you information each day in that way, and also to have that be local and credible. That being said, I would like to send a sincere thanks from me and from the entire health department to everyone that is responding to the COVID-19 situation. It would be impossible to list everyone, so I know that I can't do that, but I can say your healthcare workers, government officials, restaurant employees, transportation employees, public health department employees, and so many more people are showing up every single day to do their part to ensure that we are responding to this as efficiently as we can, as actively as we can. Also, a big thanks to our clients for being so flexible with us as we have converted some of our services to curbside and as we have had to cut back to essential services in order to help people shelter in place, but also to make sure that we're not bringing people together and having large groups of people. We're making sure to follow the social distancing advice that we and the CDC and IDPH are recommending to everyone. So as sheltering in place is being mentioned, I do want to make sure that you are staying home. I know that there was an order, but there are some exemptions to that. I strongly encourage you to stay home whenever you possibly can. This includes not having play dates, not meeting up with your friends, not going somewhere unnecessarily, finding ways to stay home so that you do not put yourself and others at risk and do not spread this illness any more than absolutely necessary. We're encouraging people to do that and to follow that order, and that includes businesses, churches, people hanging out with their friends, and whatever else might be going on that is not keeping things as contained as possible. You've probably heard the term flattening the curve, and that's what we are all trying to do. And if you don't understand what that means, that's okay, because to so many people, it's a really new term. We have posted things from the health department that does explain that. So be sure to check that information out. A really good example that we heard and we used in a release was about if there was a fire department that had to respond to fighting 100 fires in one day, it would be difficult for them to have enough staff, materials, and time to do that in that one day. However, if they were asked to fight 100 fires over the time of about 6 months, then they would be able to space things out and have enough supplies, enough staff, and enough time to more adequately fight those fires. You can help us and all of the healthcare workers and the community at large flatten the curve by just simply staying home and only leaving when you absolutely have to and when there's something that you absolutely need. One of the other things that we wanted to address today is testing criteria. We've had a lot of questions about availability of testing and a lot of people wondering why and how Macon County has not yet had a confirmed case. There are testing guidelines that are provided by IDPH, and I encourage you to check those out on IDPH's website so that you can better understand. They have changed several times over the course of this response, so I encourage you to look at those. They are very stringent, and testing kits and testing capacity is very limited. So those kits have to be used for the people that absolutely need them. In most cases, about 80% of people that have this are able to recover safely at home. So if you've had symptoms or a loved one has had symptoms of COVID-19 or any respiratory illness and you've been encouraged to stay home, please do that. If it becomes an emergency situation or a situation in which you need to contact your provider, if your symptoms worsen, or if you have any symptoms at all, call first before you go into any provider unless it is a true emergency. If you can stay and recover at home safely, then that is something that providers, IDPH, and CDC are encouraging you to do. Each person is a case-by-case situation. So please, if you're having symptoms and you have questions about that, we encourage you to call your provider directly. In addition to that, we want to make sure that all of you know that our community is working together to address all of the needs that are out there. That goes from communication to actual capacity as far as healthcare facilities, and also ensuring that people that need food that can't get out and get to it right now are fed. Volunteer organizations, social service organizations have stepped up and are doing their part. Some are doing a lot more work than they have even done in a normal day-to-day basis, and have done that quickly and adequately. However, they do need volunteers. So please check out our daily release about how you can volunteer if you are able to do that. We encourage you again to always look at credible resources. Some of those resources can include the Macon County Health Department, and then also the CDC, IDPH, and the World Health Organization. There are a lot of rumors and misconceptions that are out there, and you can really help us battle those if you get the credible information and share that. We try to address every single question that we have, every comment on social media, but with the volume, it can be very difficult to do that. So anyone that can be an advocate of the truth, anybody that can help people be prepared and not paranoid, anybody that can promote other people social distancing in every way, from at home to church to businesses to other gatherings, we all have to do our part to spread this message, make sure people understand why it is important, and truly help save lives. I've said before in a press conference that a lot of people wish that they had an opportunity in their lives to be a hero, to feel like they really did something that made a difference, to feel like they saved someone's life. And now is your chance to do this simply by staying home. There are so many heroes right now that have to get out and have to go do things to help prevent the spread of illness or provide food or provide volunteer services. But if you don't have to go out, please stay home, or at least only come out when you absolutely have to. You can help us save lives. You can truly be a hero, and we ask you to do that. If you don't understand what social distancing means and why it can make a difference, there are some really great resources on our website and also on IDPH and CDC's websites. So thank you. That's all I have for today, but please stay tuned for more information. And like I said, we do have a daily release that goes out around noon each day, so you can always count on local, credible information. Thank you so much, and we really appreciate you doing your part to help prevent the spread of illness and save lives in all communities. Thanks.